David Chung, over to you now. Listen, how concerned are you about how hospitals are going to cope with this?
Good morning. Obviously, we are quite concerned. Looking at where we're coming from, as you've referred to earlier, the system has been under quite a lot of pressure, even over the past couple of months. So we've seen large numbers of people waiting for long periods of time once they've been seen to get a bed in the hospital in emergency departments across Scotland. That's kind of a bit like us being the canary in the coal mine. It's very visible for us, and we can see, because of the situation we've discussed already in the social care sector, there's a knock-on effect throughout the entire system, right to the front door in the ambulance service, that leaves us in less of a good place as we'd like to be coming into what appears to be the threat from Omicron.
Yeah, NHS England, I'm reading in the Sunday Times this morning, NHS England talking about virtual wards, people being treated at home, maybe just getting, oximeters, oxygen measurement devices to stick on their own fingers and report back in, rather than taking up hospital beds. Does that sound like a good idea to you, something we could apply here in Scotland?
Well, I think actually some places have been doing that already. It does vary from place to place, and some GP practices have been doing it off their own bat. That in as of itself will help people monitor the situation. But what we do know is that once your oxygen saturations go below a certain level, then you're going to need the treatments that we've developed over the past year. You're going to need oxygen and you're going to need steroids, and they have a definite beneficial effect. So using that to kind of determine who needs admission may play a part, and may mean that if people are well enough, they don't need to come to hospital for assessment, which would help. But it is not going to help in terms of, have we got enough critical care capacity? Okay. Have we got enough capacity for people who are going to need oxygen and steroid therapy? And have we got enough intensive care beds?
Okay. Listen, I want to ask you both with this final question. I'll come to you first, Dr Chung. At the moment, we're told there are about 1,500 patients in Scottish hospitals, in beds in Scottish hospitals. That's more than 10% of the total capacity, who don't really need to be there, who could be safely discharged elsewhere, but they either can't be found places in care homes or simply don't want to go into care homes. How much of a problem is that?
Well, obviously, if we're looking at being able to provide wards where we can provide, as I said, treatment for COVID, every bed that we can get is essential. So if we were able to find a way to safely provide capacity for these people to go somewhere where they can be adequately looked after, that would absolutely be a priority from my perspective.
Yeah, OK. Donald Macaskill, what do you think about that?
It's absolutely critical. I spent part of Friday with senior health board officials in one health board, trying to make sure that the practical arrangements are in place so that we enable people to get out of hospital to a care home. Care homes are now amongst the safest places. We're in a very different situation compared to the beginning of the pandemic. And with all the mitigations and measures in place, they are safe places to go. And dare I say, with no disrespect, with an overloaded NHS, they are increasingly safer than your average hospital. It's up to all of us to make sure that people are not in hospital when they do not need to be, because sadly the next few weeks will result in real additional pressure on our colleagues in the acute sector.
Yeah, the viewers couldn't see it, but I can see Dr David Chung nodding vigorously in agreement with that. Listen, there's a lot to be done, isn't there, and not much time to do it. Donald Macaskill, Dr David Chung, thank you very much indeed both for your time on the Sunday Show this morning.
Thanks.
Now then, big decisions for our politicians to make.